Hello, and welcome to the Valley today. I am your host, Janet Michael. It is the Valley Business. Today we're sitting at the Front Royal Warren County Chamber of Commerce. Nikki Foster is here highlighting one of your newest members today, and we've been chatting already for a half an hour, 45 minutes, and I really like her, so good choice today.
I knew you would. We're really excited to have Dr. Emily Chan with us today, and I'm excited for all of you to hear about the wonderful service she provides and how she's doing medicine a little different here in the Valley.
Dr. Chan, let's start with what Nikki just said. How can you do medicine different in the Valley?
I have an independent private practice, family medicine office in the town of Woodstock. So being independent and being solo means I get to be the boss and I get to run the show. So we get to spend more time with patients, we get to get people coming in sooner, and we're offering an individualized, personalized approach to healthcare, which is something that is lacking in the traditional healthcare setting.
I think it's what we all dream of having.
Oh, yeah.
And some generations had that.
So
Not mine.
Some of my older patients have said, this is the healthcare we used to have. We say, yep, and that's the way that it should be. You should be able to have a relationship with your doctor. You should be able to walk in and the receptionist knows who you are. You should feel comfortable. And you should feel heard and seen, which is something that all of our patients have really been excited about.
And so you're a primary care physician, which means you can do all of the things?
Yes, I'm a board certified family medicine physician. I treat newborns all the way up to elderly. I do all types of preventative visits as well as chronic condition managements and acute sick visits. So I do a little bit of everything. I love all age groups. It brings me a lot of diversity to my day. No 2 days are the same. I'm not bored. and I love seeing 3 generations of families, the kids, the parents, and the grandparents. It is so much fun for me to be able to treat an entire family and really live up to my name and what my title is as a family medicine doctor.
I would imagine that since opening your practice, you've had people that have come in and started off with, you probably can't help me with XYZ, but, and then you're able to say, actually, let me tell you what we can do.
Actually, I can, yes, because now I get to focus on more preventative healthcare too. So we get to sit down and talk about your family history, what you are worried about. So I can tailor my approach and tailor my healthcare plan for you based off of what's important for you. If your goal is you're in your 50s and you don't want to have dementia because that's something that the older people in your family had, we can work on a plan to make that happen. Or if you tell me that every man in your family had a heart attack before they turned 60, let's figure out a way to prevent that as much as we can. Or even if your goal is you're older and you want to stay in your house, you don't want to go to a nursing home, I can help you optimize your health to do that, or provide resources in the community, because I'm connected with a lot of different agencies and specialists in Shenandoah County, down in Harrisonburg, Winchester, Front Royal. I've been in the area for a long time, so I know a lot of the players. So I can connect you to the right people for you to get the right care.
And that's important because I think sometimes in our current state of healthcare, you go see a doctor and you feel like you're under this tick-tock of the sand dripping through the hourglass before you've got to get out so he can see the next person.
Yeah.
And they don't always have access to nonprofits that maybe can help someone stay in their home longer by making it safer and removing rugs and doing those things. Having somebody who can do that whole picture is hugely beneficial.
I think that health is not just numbers on a scale, numbers on a blood sheet report. Health really is the whole body. So it's your family, it's your community, your support system, your faith, your workplace, your mental health, your emotional health, everything in between. So my goal is to make sure that everybody gets the best health that they can, and that means tapping into things that are not necessarily traditional healthcare. One of the greatest joys that I have is actually taking people off of medications. I love it. So if I can have you be on less medication, if I can cut some things out completely or consolidate 3 pills into one, I'd love to do that. So it makes it an easier process for everybody.
I wonder if there's also that misconception that you can write prescriptions, you can look at medication, you can do all of the other things. I think sometimes we've just become so accustomed to you have to go to the institutional place for your medical care that we're thinking what you're doing is something crazy, weird, and out there, and it's really not.
No. Primary care physicians do a ton of stuff that people don't realize. We fill out forms. We look at all of your specialist reports. I look at your emergency room visits, the imaging that you had done by a specialist, and I consolidate all of that. So I have some patients who are very complex and they see a lot of specialists, and they come to me because we will review everything that's happened to them in their healthcare journey over the last 3, 4, 6 months. And we just sit down, we talk about what happened at this visit, what are you supposed to do, what did happen, and what fell through the cracks. And sometimes it's just, I get to re-explain it to them of what does this mean. Sometimes people don't understand what happened, or it's too emotional of a visit and need time to process. So I serve sometimes as that person, a physician, on part of their care team that re-explains it. And sometimes I'm the only physician in their entire medical team that knows everything, because the specialists know their specialist stuff.
Right.
But I'm the one person that receives all the reports from everybody. I take it, I read it, I consolidate it so that we can figure out that the heart doctor and the kidney doctor and your brain doctor and your lung doctor, and they're all working in the same path.
It's so valuable to have that one person that you can depend on to connect all the dots. Because as a patient, we may not know what we should be asking the kidney doctor about our heart condition, and they may not have the answer for that either. They can only tell you, like you said, within their sphere.
And truthfully, these specialists, they are working so hard, and they have a lot of times shorter time allotted per patient. Whereas in primary care, just by default, we do have more time. And especially in my model with our membership care office model, I can spend as much time as you need.
So explain the membership model to me.
Our office is a membership-based practice, which means there's an annual membership fee, which is $2,500 for the year. It does not have to be paid in full. It can be cut in half or paid quarterly. So you pay for that membership, and then I still bill your insurance for the routine visits. So I do accept insurance. By doing so, it allows me to have a smaller panel of patients, so I'm not taking as many patients as I used to, so that each patient can get more time. You get more time to sit, talk, think, reflect, read, and there's more back and forth.
I was going to ask how that would work, being able to spend more time with patients, because the reason that it is like it is now in traditional medicine is because they got to make sure they're meeting that bottom line number.
Absolutely.
That's really a pretty ingenious way of doing it, and it's such a small price to pay to know that that's the safety net that you have now.
Yeah, so to have a doctor that knows you, to have a doctor that's on call for you, because if my patients have an emergency after hours, they can call and they will reach me, and we can figure something out together, whether they need to go immediately to the emergency room because it's a true emergency, or if this is something that can wait until the next day, and I have slots in my schedule to book them so that I can see the next day, or if I can't do it same day, I'll do it the following day.
Well, and that membership fee that we're talking about comes with a physical. Could you explain that a little bit? Because that's a really valuable thing to have.
Yes, so the main thing what you get from the annual membership is you get once a year an executive style physical. So I'm very proud to be the first one in the Valley to offer an executive style physical, where we are going to be focusing on preventative health care. And this is specialized testing. So we are doing testing for your eyes, hearing, your lungs, your heart, skin, body composition, their own body fat mass, percentage, those types of things. It is a very, very thorough and complete assessment of your health, and patients are loving it. They get to learn stuff about their health that they didn't know about before.
And it's things that you don't know you need to know until something happens. But if you know about it ahead of time and can prevent that thing from happening.
Oh, it's worth it. Oh, it definitely is worth it. And for the testing that we offer in the executive physical, insurance doesn't typically cover this. So that's why the membership is what covers these testings. We also do blood work as part of this executive style physical that will check for inflammatory markers, advanced cholesterol testing, as well as markers of heart disease.
When you talk about testing, so let's say I was going to say fall off my bike and break my arm, but everybody knows that I wouldn't be caught dead on a bike because it's too much like exercise. Sorry. So, but for things like that, I need an X-ray or I have to go get blood work somewhere. How do you handle? Do you do that in-house? How does that work?
So in my office, we do have a lab on site. So we do draw our own blood. So you don't have to go to a facility for that. We can draw our own blood. We also offer some point of care testing, which means testing that's done in the office when you're there. care. So these are things like a urine dipstick test if you think that you might have a urinary tract infection, if you're having the sniffles or a sore throat. We have rapid flu, rapid COVID, and rapid strep testing available. And then we also will draw blood and send it out to either LabCorp or Quest for routine stuff. Now for imaging, that is going to be at a larger facility. So we do not have X-ray, CT, MRI, or ultrasound capabilities in the office.
But that's easy enough too, to schedule somewhere, your insurance handles it all, and then they bring back to you, this is what they found, and then you can then explain to them what that is and how it works.
Oh, absolutely. And because we do take insurance, we just submit the bills anyways for you. So I order a test for you, like an X-ray, you go get it done, I already get the result by the time you come back. So you don't really have to do too much to bring the results to me. They will automatically come, whether it's blood results or imaging testing.
I feel like this is also a good alternative for someone who maybe is in their 20s in really good health, in really good shape. Healthcare insurance and those kinds of things are not cheap to come by these days, and maybe this is a better option for them to do this membership and pay as they go.
Absolutely, because all patients have to be part of the membership, but if you do not have insurance or you don't want to use your insurance, we do have options for pay per visit.
I didn't realize how valuable that was until I had a friend who she was going to get some sort of blood work done, and she didn't necessarily want the insurance company to know what the results of that were, because then it factors into what her premiums may be and all of that other sort of thing. I didn't even know you could do that.
Yes. Well, because I'm an independent doctor, I have my own independent accounts with the lab companies. So if we wanted to, we can do almost like a group buying discount purchase of an individual cash pay for the lab. So we can offer that if you don't want to run it through your insurance.
What is the biggest misconception that you've heard from people so far that have made an appointment and come in to see you? What has been the most shocking thing to them?
I think the most shocking thing to them is they think it's too good to be true. And then they come and they realize, oh no, this is real. It's real. It's real.
What do you want people to know? So someone's listening today and they're still saying, I don't know about this. This seems too good to be true.
I invite anybody who's interested to call our office and schedule a meet and greet. We offer complimentary meet and greets where you get to come to the office, meet the team, tour the office. I'll show you the executive physical room, and then we can sit down and talk. We can talk about the membership. We can talk about your health, and then you can figure out if this is the right fit for you.
That in and of itself is also unheard of.
I will say, when I've been doing some of these meet and greets with patients, I cannot tell you the number of times that people have said, you have spent more time with me on a meet and greet than my other doctors have in a regular visit.
And in some cases, 3 or 4 visits tied together, you spend more time with them in that nature.
Yeah.
And so your office is in Woodstock, but where are your clients coming from? Obviously Warren County and Front Royal, or we wouldn't be talking to you right now.
Of course. So my patients are coming from all over the valley. Frederick County, Clark County, Warren County, Shenandoah County, Page County, Rockingham, everywhere.
And what are your office hours?
So we are open Monday through Friday, 9 a.m. to 4 p.m. We are on Main Street in Woodstock. I tell people we are next door neighbors to the John Deere tractors. So it's a very easy landmark to find us. And our phone number is 540-459-1990, and we're more than happy to take calls, answer questions, and schedule a meet and greet.
Do you have an online presence? Do you have a website, social media, any of those things?
Yes. So our website is through MDVIP, which is the parent company that has helped me with this membership model. So it's mdvip.com/Emily Chan MD. We're also on Facebook and Instagram and LinkedIn. You just search my name, Emily Chan MD, or Dr. Emily Chan. You'll find me.
And I want to go back to something you just said too. This isn't an idea that you have that you're implementing. This is a bigger, broader, nationwide thing. This isn't something new you're doing just in Woodstock.
I did not invent this. No, I partnered with MDVIP. They are the leaders in this membership-based primary care model in the country. They have about 1,400 doctors nationwide. I decided to partner with them, so we're the first in the valley to be able to do this.
I think it's fantastic.
I do too.
It's also fun for patients. One of the perks or benefits of being a member is if you are traveling, let's say you're a snowbird and you go down to Florida and you get sick, we can actually hook you up with one of the MDVIP doctors down there. My office will coordinate with their office, and you can be seen for your sinus infection or your urinary
Whatever.
infection. Yep.
That's outstanding.
Yeah, and you don't have to pay extra for that. It's already kind of part of the membership, so you
Yeah.
can see all the other doctors, and they just bill your insurance just like any other place would.
I love that.
I do too.
That might actually encourage me to go on vacation. I don't know when, but how cool is this?
Right? Isn't it wonderful? Yes. I'm very excited to have Dr. Chan on board with us and serving the Valley.
And you're going to be at business after hours.
Yep.
People are going to get to meet and talk to you and things like that. So you're going to be around for people to, even before they schedule a meet and greet, to see you and ask you questions and talk to you as well.
Oh, absolutely.
I
I'll be
think that's
attending
fantastic.
lots of events with the chamber.
Coffee and conversation. She can come to coffee. Wait, are you doing coffee and conversation this
Not in
month? Because it's a
July.
holiday-ish.
No, we will not be. Yes, this will be the first time in 23 months, because we've had 23 coffee and conversations, that we haven't had one, but it's on July 3rd. And the amount of people that...
It is the official holiday.
It is the official holiday, and the amount of people that are going to get up at 9 a.m. and come to Coffee and Conversations probably isn't high. It's probably not super fair to a presenter, so we are going to skip July because it is technically the holiday.
And come back in August.
We'll be back to regular scheduled programming the first Friday in August.
So what else do you have going on coming up in the next couple of weeks?
So we have Play Favorites hosting July's Business After Hours.
Nice.
And so it's the third Tuesday in July rather than the fourth Tuesday in July. So mark your calendar for July 21st.
Okay.
Being hosted by Brett and Hannah Beeman at Play Favorites. You know those guys are wonderful.
Oh, there are going to
So
be
much
games.
fun.
There's going to be
Yes.
so many things.
It's going to be, just come. It's just going to be so much fun. So 5:30 to 7, hope to see you there. If you're not a chamber member, you are welcome to attend. We'd love for you to see what the chamber's about.
Fantastic. Anything else going on?
Tons of stuff. Like, we're already planning for all the fall activities.
Do not say the C word. We're not in July talking about the Christmas parade. I refuse.
Well,
Stop.
okay. Listen. Just so you know, I have received 4 emails in the last 7 days asking for applications to the Christmas market and the Christmas parade. So
It's
whether you
insane.
like it or not, my friend, it is the time to start talking about
That
it.
is so
And I
crazy.
will also have you note that there are Halloween decorations and things already in the stores. So folks are already doing that.
I can't. I can't.
It's happening.
But these are the people that should be seeing Emily because they're clearly planning ahead.
Right, sure, exactly.
You want to plan ahead for your health? I'm a one-stop shop for that.
So where can they find all the details about what's going on in the chamber?
FrontRoyalChamber.com, on our social media, Facebook, Instagram, we're on LinkedIn as well, all the places.
Thank you for connecting me with Dr.
Thank
Chan.
you. Isn't she great?
She is fantastic.
Thank you so much for having me, ladies, and it's a pleasure to be part of the chamber.
I will be back tomorrow, live show. Captain Warren Gosnell from the Frederick County Sheriff's Office.
So
It's like
I'd
that.
like for you to ask him a question for me.
Yes.
Yes. So most recently, and you know what our Main Street's like, I have seen 4 people make U-turns in the middle of Main Street, like in the movie theater area. And not only have I seen 4 people make U-turns, I've also seen 2 of those people make a U-turn and then park going against the traffic. So I'm wondering, is that allowed?
I can, with a great degree of certainty, tell you no. And those, do you offer psychiatric services, Dr. Chan? Because I feel like that's what those people need.
Agreed.
But I will totally ask him.
all.
He will have so many answers for that
Okay,
question,
that would be
I
wonderful.
suspect.
That would be wonderful. I'd love to hear Gaz's answer to that
Yes.
question.
So meet me back here for that tomorrow, just a few minutes after noon.